We're kicking off Season 4 of the Medical Money Matters podcast, and we're celebrating something big. Over 10,000 downloads. Listeners tuning in from nearly 1,000 cities across the country and even internationally. And we're entering our 4th year of episodes. Honestly, that number still stuns me a little. When we launched this podcast, our goal was simple: to help physicians and practice leaders navigate the business of medicine without losing sight of why they went into medicine in the first place. We wanted to demystify the money side, to have honest, clear conversations about things like revenue cycle, financial strategy, payer policies, and practice independence. We believed then, and we still do now, that when doctors understand the financial side of their practice, they're better equipped to lead, grow, and stay independent. And we're just getting started. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and in 2025, I released Physician's Edge, the first of its kind CME-accredited online business education for physicians. My passion is to increase financial and business literacy for physicians. Episode 157, celebrating Season 4, 10,000 downloads, 1,000 cities, and our gratitude to you. We're kicking off Season 4 of the Medical Money Matters podcast, and we're celebrating something big. Over 10,000 downloads. Listeners tuning in from nearly 1,000 cities across the country and even internationally. And we're entering our 4th year of episodes. Honestly, that number still stuns me a little. When we launched this podcast, our goal was simple: to help physicians and practice leaders navigate the business of medicine without losing sight of why they went into medicine in the first place. We wanted to demystify the money side, to have honest, clear conversations about things like revenue cycle, financial strategy, payer policies, and practice independence. We believed then, and we still do now, that when doctors understand the financial side of their practice, they're better equipped to lead, grow, and stay independent. And we're just getting started. Before we go any further, I want to pause and say thank you. Whether this is your first episode or your 157th, whether you're listening during your commute, on a walk, or between patient appointments, we are so grateful that you've taken this time to be part of this community. We've heard from solo physicians running lean operations, administrators managing multi-site groups, CFOs navigating razor-thin margins, and private equity-backed groups trying to stay grounded amid constant change. Every one of you has helped shape this podcast. You've shared questions, sent feedback, forwarded episodes to colleagues, and asked us to dig deeper. And we're here because of you. This season is about reflection, but it's also about gratitude, both personal and professional. As we enter a season of Thanksgiving, I can't help but think about what a privilege it is to serve the people who serve others. You care for patients. You manage complexity. You make 1,000 small decisions every week that keep your teams afloat and your doors open. So today, we're going to take a moment to celebrate where we've been, share some of what's ahead, and reintroduce you to the heartbeat behind this podcast, our company, Healthy Practices. We'll also offer a gentle reminder that while this podcast is free and filled with resources, there's more we can do to help whenever the time is right. Let's rewind just a little. 3 years ago, we launched Medical Money Matters with a simple premise. Most physicians didn't go to business school, and yet you're running multi-million-dollar businesses. And often, you're doing it without the training, support, or visibility into the finances that you deserve. We wanted to change that. We knew that practice management was full of jargon, that revenue cycle data was confusing, and that financial strategy often fell out of reach for physician owners. So we started small, clear, focused episodes on key topics like coding opportunities, payer contracting, compliance audits, succession planning, and what to do when your revenue cycle isn't performing. We've talked about the power of flowcharts and decision-making. We've explored codes like G2211 that go overlooked, but add real dollars to your bottom line. We've unpacked the silent friction between finance and revenue cycle. And we've told the truth about how compliance culture, when left unchecked, can suppress physician income and group resilience. And through it all, you've been listening. From Seattle to Sarasota, from big cities to rural clinics, from startup practices to mature multi-specialty groups. You've tuned in, shared episodes with your team, brought questions to your leadership meetings, and told us that this content matters. We don't take that lightly. This podcast is just one of the ways we support our clients and the broader community. If you're new here, let me introduce or reintroduce you to our company, Health ePractices. We're a medical consulting and revenue cycle group focused on helping physician practices succeed on their own terms. We work with independent groups, hospital-affiliated practices, and everything in between. Our passion is helping medical organizations become financially sound, operationally effective, and strategically prepared for the future. And the future is not standing still. Here at Healthy Practices, we stand for independence, not because we're against consolidation or collaboration, but because we believe that when physicians and clinicians have real choices, backed by real data and strategic clarity, they make better decisions for themselves, for their teams, and for their patients. Our work focuses on several core areas: financial strategy, revenue optimization, compliance and risk management, staffing models, and leadership development. We don't just look at spreadsheets, we look at systems, culture, workflow, alignment. We help you connect the dots so that your operations and your finances are pulling in the same direction. And when we work with clients, we don't want them dependent on us forever. We believe in building internal capacity so that your group gets stronger even after our engagement ends. That's part of how we measure success, not just by what changes while we're involved, but by what continues long afterwards. We also know that not everyone needs formal consulting right away. That's why we offer an extensive library of free resources on our website, from downloadable guides and FAQs to archived blog posts, and of course, this podcast. It's all there, and it's all designed to help you gain clarity and confidence. And if you ever do want to talk through something more directly, we always start with a no-cost introductory meeting. It's just a conversation, no sales pitch, just a chance to hear what's going on in your practice and offer a few first steps, whether we end up working together formally or not. Our goal is simple: to make sure your next decision is more informed, less stressful, and aligned with your long-term goals. We are here to help, and we mean that. We also know the world you're navigating is changing quickly, from payer policy updates to compliance shifts, from the pressure of rising labor costs to uncertainty about AI's role in healthcare. It's a lot. Add in the occasional government shutdown, new CMS rules, or shifts in reimbursement, and it's easy to feel like you're always reacting. We want to change that dynamic. That's why in Season 4, we'll be diving into some of the most important and most urgent topics affecting physician practices today. We're going deeper on revenue cycle modernization, what works now, what's outdated, and how to tell the difference. Tectonic shifts. The new Medicare rule for 2026 is out, and it's a doozy. AI in healthcare operations, where it's useful, where it's not, and how to approach it responsibly. Strategic growth and succession planning, especially for physician-led groups wondering what's next. Profitability levers, coding, contracting, staffing, and capital, how to pull the right ones in the right order. Leadership development, because leading a practice isn't the same as being a great clinician. And real-world stories from groups who've navigated challenges like payer audits, merger offers, burnout, and unexpected change. We're also planning to bring in guest voices this season, people in the field who are solving hard problems, experimenting with new models, or offering hard-won insight. And we want to hear from you. If there's a question you'd like answered, a topic you want unpacked, or a story you're willing to share, please reach out. Your input really does shape this show. Because at the end of the day, we're in this together. Whether it's AI disruption, another payer policy update, a government shutdown, or something else entirely, we're here for you. We believe in physician leadership. We believe in the value of independent practices. And we believe that when you have the right tools and support, you don't just survive, you thrive. So as we begin this next season of the podcast, here's what we want to leave you with. Thank you. Thank you for being part of this journey. Thank you for the work you do in our practices, our communities, and in this profession. Thank you for making time to learn, to think strategically, and to consider what's next. And when you're ready, when a problem feels too big or the way forward feels unclear, we're here to help. Whether that means downloading a free resource, listening to another episode, or booking a time to talk, know that our door is always open. We measure our success not just in clients or contracts, but in the strength and independence of the physician practices we support. Because when your group is healthy, financially, operationally, culturally, your care is better, your team is stronger, and your future is more secure. So here's to Season 4. Here's to 10,000 downloads and counting. Here's to nearly 1,000 cities tuning in. And here's to you, our listeners, our clients, our community. If this podcast has helped you, if it's sparked a conversation or given you clarity, please share it. Subscribe if you haven't already. Visit our website. Use the tools. And when it's time, raise your hand. We'd be honored to support you. Thanks for being part of Medical Money Matters. Let's keep going together. Until next time. Thanks for joining us on the Medical Money Matters podcast. You've been learning about financial topics here, and you should be asking yourself, are we maximizing our revenue cycle? Your revenue cycle team needs support too. That's why we've created the Revenue Cycle Leadership Series. It's the ultimate resource for mastering revenue cycle management. Your team will learn to lead with confidence, optimize your processes, and capture every dollar your practice deserves. Led by national revenue cycle experts Kim Tolliver, Taya Gordon, and Jill Arena, we offer expert guidance and actionable strategies. This series will transform your revenue cycle from a challenge into a competitive advantage. Take charge of your financial success today. Visit healtheps.com/revenue-cycle-leadership-series to get started. Until next time, keep leading, keep growing, and keep thriving. See you on the next episode of Medical Money Matters.